Hello friends, I am Shaurya Mishra. Welcome you to your own YouTube channel, Vision Care Advisor. Friends, I am continuing the one-liner series in ophthalmology, part 3. These one-liner will help you to solve all type of MCQs. So, without taking much time, let's get started. Poster spots are seen in pathological myopia. Suspensory ligament of Lockwood, also known as hammock-like check ligament, is an important ligament found in orbit. Suspensory ligament of Lockwood prevents downward ligament of the eye, also called sagging of the eye, and this prevention helps us to our eye keeps in position. Kretschmer spots, dust line, epithelium rejection line, and corneal edema are signs of corneal graft rejection. Iris pulse are pathognomonic for leprosy. Iris pulse is composed of dead lopra bacilli within histiocytes. Iris pulse is a white glistering beads at the pupillary margin. You can see in the picture. Umbrella configuration on fluorescein angiography is seen in central serous retinopathy. Brush field spots are white or yellow colored spots seen on anterior surface of the eye. Most common cause of epidemic keratoconjunctivitis is caused by adenovirus pathogens. Most common cause of red eye in the world is adenovirus conjunctivitis. Most common cause of acute hemorrhagic conjunctivitis caused by enterovirus 70 and a variant of Coxsackie virus A24. Drug of choice for neovascular glaucoma, uveitic glaucoma, and malignant glaucoma is atropine. Magnification produced by direct ophthalmoscopy is 15 times. Campimetry is used to measure the field of vision. Satellite lesion in the cornea is seen in fungal corneal ulcer. Viral infection usually causes keratoconjunctivitis. Ocular complications in herpes zoster ophthalmicus usually appear at the subsidence of the skin eruptions. Secondary glaucoma in the early stages of herpes zoster ophthalmicus occurs due to trabeculitis. Systemic steroids in herpes zoster ophthalmicus is useful if started immediately after the onset of rash. Shifting fluid is seen in exudative retinal detachment. After vitrectomy and silicone oil infusion, you would ask the patient to maintain prone position. Macugen was the first anti-vascular endothelial growth factor agent approved. Bevacizumab is the most commonly used antivascular endothelial growth factor worldwide. Anterior surface of the cornea is the most important factor in influencing the light rays to focus on the retina. A yellow-white patch of interpalpebral bulbar conjunctiva is located just nasal or temporal to the limbus impingicula. Trachoma in newborn cannot produce follicular reaction because adenoid layer is devoid of lymphoid tissue. Severe purulent discharge is typically of gonococcal infection. Keratopathy associated with vernal keratoconjunctivitis occur in the inferior punctate epithelial erosions. During phototherapy, eyes are covered to avoid retinal degeneration. ICG is the best imaging tool for choroidal vessels, while FFA is the best for retinal vasculature. The refractive index is the maximum at the center of the lens. Visual axis is the line joining the fixation point, that is object, nodal point, that is center of the lens, and fovea. Optic axis is the line passing through the center of the cornea and center of the lens to meet the retina on the nasal side of the fovea. Fixation axis is the line joining the fixation point, that is object, and the center of the rotation. Angle alpha is the angle between the optical axis and the visual axis at the nodal point. Angle lambda is the angle between pupillary axis and the line of sight. Angle kappa is the angle between the visual axis and the pupillary line at the cornea. Angle gamma is the angle between the optical axis and the fixation axis at the center of the eyeball rotation. Inferior orbital fissure is formed between the greater wing of sphenoid, that is lateral wall, and maxilla, that is floor. Inferior division of ophthalmic vein passes through the inferior orbital fissure. The infraorbital vessels are found in the inferior orbital fissure and travel down the infraorbital groove into the infraorbital canal and exit through the infraorbital foramen. Ciliary body is called dangerous area of the eye. Pars plicata is the site of production of aqueous humor. Corneal endothelial cells count is measured by specular microscope. The cell density of endothelium is about 3000 cells per millimeter square in young adults and decreases with advancing the age. 1 mm shortening of the axial length or anteroposterior diameter of the eyeball will be lead to 3 diopter of hypermetropia. 1 mm increased of axial length or anteroposterior diameter of the eyeball will be lead to 3 diopter of myopia. 1 mm increased in radius of curvature will be lead 6 diopter of hypermetropia. 1 mm decreased in radius of curvature will be lead 6 diopter of myopia. Both anterior chamber and posterior chamber contains aqueous humor. Posterior chamber contains vitreous humor. I hope this video would be helpful for you. Thank you for watching. Stay tuned for more updates. Please don't forget to check your eyes yearly and see the world clearly.